Should I plan for intermediate care at or before turning 65? Almost a fourth of the U.S. populace will be senior residents by 2060. As the populace gets progressively more seasoned, the predominance of American grown-ups with at least two ongoing circumstances is likewise rising. That is the reason you must comprehend your choices when it comes time for your cherished one to move to a senior living local area. From free living networks to talented nursing offices, your adored one has choices. Today, we need to enlighten you concerning one of those choices: transitional consideration. Transitional consideration offices are intended for seniors who aren't completely free, however aren't exactly prepared for a nursing home. Could it be said that you are fretted over finding a reasonable, safe choice for your cherished one as the person ages? Then take a full breath and continue to peruse on the grounds that we made this aid for you. What are the various degrees of senior living? A transitional consideration office is a kind of senior living local area for people past retirement age. Yet, it's not by any means the only sort of senior living local area out there. With so many choices, it tends to be hard to conclude which local area is ideal for you. Allow us to loan you a hand. While picking the ideal local area for your cherished one, you want to think about clinical, nursing care, and individual consideration needs. Clinical necessities incorporate how frequently the inhabitant should see a specialist. Nursing care needs characterize which nursing administrations the occupant will require consistently. Individual consideration needs allude to exercises the inhabitant could require assist with every day. The degree of clinical, nursing, and individual consideration as senior necessities decides the best senior local area. Autonomous living. An autonomous living local area, IL, is for senior residents who can in any case live freely. ILs are comprised of lofts, townhouses, or even single-family homes. The people group serves seniors just, permitting occupants to live among their companions. Free living networks give a lot of freedom. In the event that an occupant needs care, a few offices join forces with private obligation organizations that offer senior administrations. The Confidential Obligation Organization frequently holds an office on the local area grounds. Help Living Networks, AL, these offices are like ILs. Be that as it may, ALs are more qualified for seniors who need support with day-to-day exercises. ALFA requires all ALs to give free living style networks. ALs should likewise offer coordinated get-togethers and confidential obligation administrations. Confidential obligation administrations and help living networks might incorporate transportation, actual health, piece backing, or prescription administration. Gifted nursing offices. A gifted nursing office, SNF, is one more name for a nursing home. These offices are intended for seniors who need non-stop consideration. SNFs give that consideration gifted clinical medical caretakers. SNF medical caretakers are typically enrolled attendants, RNs, or authorized reasonable attendants, LPNs. Occupants might require a talented medical caretaker on the off chance that they can verifiably benefit from treatment. In particular, on the off chance that they can profit from at least 2 of physical, word-related, or language training. Some SNFs can likewise exist inside the retirement networks we've referenced previously. In these cases, the occupant lives in their own home or loft. The gifted office offers the types of assistance they need, example, restoration, ongoing emotional well-being care, and so on. Frequently, SNF occupants can meet all requirements for government medical care. In any case, Federal health care puts time limits on how long it will pay for talented medical attendants, as long as 100 days, before the expense should emerge from pocket. That is the reason most SNFs are viewed as momentary arrangements. Persistent Consideration Retirement People Group. Ceaseless Consideration Retirement People Group, CCRC, are special since they consolidate every one of the three of the above offices onto one property. These people group put need on taking care of SNF occupants. Confidential obligation administrations are accessible for AL and IL occupants. CCRCs are an incredible long-haul decision for seniors. These offices consolidate numerous degrees of care, meaning occupants will not need to move to one more local area as they age. Occupants can feel like they're becoming old with different inhabitants locally. A CCRC is an office that gives persistent consideration to its inhabitants. Constant consideration is required for individuals who need at least 2 doctor visits each week, gifted nursing from RN or LPN, or potentially different medicine changes in a 24-hour time frame. What is moderate consideration, and who needs it? All in all, what is viewed as moderate consideration? Halfway consideration offices were established to really focus on the intellectually impaired, genuinely weak, and persistently sick. However, it's normal to consider older occupants in these offices to be well. Middle consideration is somewhere between a gifted nursing office and a help living local area. Occupants get to live locally of their companions. They can likewise get to every minute of everyday clinical consideration from the solace of their own home or condo. All in all, who requirements middle-of-the-road care. Middle consideration offices ordinarily give 3 distinct degrees of care for their inhabitants. Continue to peruse to become familiar with every one of them. Middle light consideration. The various degrees of moderate still up in the air by the quantity of exercises the patient necessities assist with. Middle light consideration implies the occupant needs assistance without any than 2 exercises each day. Halfway light consideration additionally incorporates occupants who need oversight once in a while. They may likewise require infrequent social administration. Transitional moderate consideration. Transitional moderate consideration is great for inhabitants who need 3 or 4 exercises administered every day. For instance, the inhabitant could require assist with drugs 2 times every day, washing 1 time each day, and utilizing the bathroom. Occupants who need middle moderate consideration may likewise require oversight and social administration. Notwithstanding, these patients ordinarily need these administrations on a more incessant premise than transitional light consideration occupants. Moderate weighty consideration. Halfway weighty consideration turns out best for inhabitants who rely upon another person for every one of the 5 fundamental exercises of day-to-day living, ADLs. This incorporates washing, eating, dressing, utilizing the bathroom, moving from the bed to a wheelchair as well as the other way around. Middle weighty consideration patients likewise need oversight and social administration. These administrations are normally required non-stop for halfway weighty consideration patients. The advantages of middle consideration offices. A senior who can't live totally freely, yet requires less concentrated care than a SNF patient is the best possibility for long-haul moderate consideration offices, ICFs. Still not persuaded an ICF is ideal for your adored one? Then you really want to be familiar with the advantages of these networks. Continue to peruse for our best 3. ICFs are reasonable. ICFs can be run with negligible managerial above and assets when contrasted with a medical clinic. Most patients likewise require lower levels of management from medical attendants. Low serious consideration inhabitants may not need specific nursing by any means. For these reasons, middle-of-the-road care offices are considerably more reasonable than elective senior consideration arrangements. Rather than picking a nursing home, patients can get the consideration and freedom they need for a decreased expense. ICFs offer patient freedom. Like most senior living networks, ICF occupants can accomplish an elevated degree of freedom. Medical caretakers and doctors are accessible when required, yet aren't around it throughout the hours. This is particularly valid for occupants who need moderate light consideration. Concentrates on show that, when seniors feel free, their personal satisfaction moves along. Simultaneously, inhabitants can fabricate certainty and inspiration, since they have command over most of their everyday exercises. ICFs give normalized care. Another explanation ICFs are more affordable than nursing homes and different choices is on the grounds that patients just get the consideration they need. That is on the grounds that ICFs offer more engaged administrations than options. For instance, an ICF can act as an extension between residing at home and dwelling in the emergency clinic for broadened time frames. Your adored one stands out than the individual necessities, since care is totally normalized. ICFs are managed. With regards to picking the right retirement answer for your cherished one, you might be stressed over picking a disappointing local area. You never need to stress over that with ICFs on the grounds that these foundations are profoundly controlled by states. States require each ICF in their ward to pass record verifications and reviews. They should enroll for a permit to work. Besides, states direct yearly examinations of ICFs to guarantee they are consistent.